Whether you have pain in your back or joints, surgery may not be the answer. Instead of the dangers involved in cutting out tissue, consider healing and rejuvenating the area with stem cells, platelet-rich plasma, or prolotherapy. The treatments that are available to professional athletes are now available for you. Watch the videos at jointrehab.com or call the Darrow Wellness Institute at 800-300-9300. 800-300-9300. That's 800-300-9300.
This is Dr. Marc Darrow and Dr. Thomas Grove on Living Pain Free. It's a show where we talk about regenerative medicine and how to heal your musculoskeletal orthopedic pain or arthritis with stem cells and platelets. Very simple procedures where we take your blood, spin it, and inject it. We can also take your bone marrow. It takes about the same time as doing a blood draw. Very simple the way we do it, not painful. And we can take your cells, put them where your problem is with a small needle, and help you heal. We stimulate tissue to grow. So, John, you've been very patient. Thank you very much. John has a trigger finger in his pinky and is wondering if this would need treatment. So, John, do you mind if I ask you a couple questions about it?
Sure.
Okay. First of all, I'm going to give out the phone number so we can get some other callers, so hang with me for just a second. To call us live right now, you can talk to us like John is doing at 866-870-5752. If you call in right now at 866-870-5752, I'm going to send you out a free book on stem cell and platelet therapy. Regenerate, don't operate. We love the surgeons, we just don't love all the surgeries that are being done. This book is a weighty tome of research. It's got 250 scientific studies on stem cells and platelets and how surgeries are failing people more and more. We know that surgery is the culture of medicine, surgery and drugs, but Dr. Grove and I have taken what I'm going to call a higher path to heal people without the use of surgery. Minimal side effects to what we do. People get a little bit stiff afterwards, sometimes for a day or longer, but certainly nothing like what we see with surgery. I had a surgery while I was in medical school. I was very excited about it. I was doing orthopedic surgery, and I asked my boss to operate on my shoulder, which had a problem from weightlifting injury, and lo and behold, I came out of there with an arm that was like a balloon full of fluid. I had a high temperature and terrified. And that shoulder never healed until, guess what? I injected it myself as an experiment. And by the next morning, it was 100% full range of motion and pain-free. And that turned me on to regenerative medicine. I've been doing it ever since. Since those days, I've done both my knees, shoulders, elbows, right wrist. I've had other doctors do my neck and back because I can't reach there. And it has worked on me every single time I have done it. Sometimes it's been quick. Sometimes it's taken a few treatments. We never know ahead of time. Anyway, John, you've been patient. So are you right-handed or left-handed?
I'm right-handed.
And which pinky is bothering you, left or right?
It's the left hand.
Okay. And what kind of activities have started this for you?
You know, I could never trace it to an activity. It just sort of, I noticed that it wouldn't extend all the way. And sometimes, you know, even with, I'd have to use my other hand to open my finger.
Okay. Does it trigger? Does it actually snap when you pull it open?
It does snap. It snaps sometimes.
Okay.
It usually, you know, it doesn't snap all the time, but like right now it would need to be snapped, yeah.
Okay.
That's
kind of unusual that you don't have any overuse type of syndrome with it. I mean, do you play golf?
I do play golf.
Okay.
But I didn't notice that it happened, like, you know, right after a golf round. I just noticed it one day.
Sure. Well, trigger finger, Dr. Grove, do you want to expound on what that actually is?
Yeah, so trigger fingers, basically, there's a little part where that tendon gets caught up. It's called the A1 pulley, is kind of the more common area. Just right over the top of your knuckle there is where that tendon kind of gets stuck and caught. And then when that thing gets triggered is when it kind of you're not able to really straighten that thing out all the way.
So there's several things that can be done, John. Number one is the obvious thing. You stop doing what's causing it. In your case, you're not sure what it is, but you do play golf. So if you were to come in, I'm an avid student of golf. I'm not a great golfer, but I love the game. And I just happened to look at, I belong to Mountain Gate Country Club. Do you know where that is? Behind the Getty Museum. Okay, so today I was looking up what my spending has been this month. I have had, in this month, I've had 8 lessons. That's 2 a week, which gets expensive. So I love taking lessons because when I'm with my teacher, I hit really, really well. And, we're hitting off of flat ground and all that. It's not like being on the course. And I am developing a brand new swing, which I adore. I love it. Do you know what early extension is in golf when you, at impact, where you push your hips up into the ball and stand up to get power?
That's not one that I heard of, no.
Okay. Well, that's what I used to do. Now I'm doing, more of the classic swing of pivoting around. And I'm really excited about it. It's taken me a long time to get it. But nevertheless, when we play golf, we often get very repetitive. And what I would do with you is I'd look at your grip, because your pinky may be stuck in that other right hand in a place where it doesn't really want to be. And that could be causing this trigger finger. If there's no other repetitive activity you do that you can think of, I'm going to say, just based on what you're telling me, it's going to be your grip in golf. Now, do you pound balls at the golf course, at the range?
Yeah, I limit to maybe 20 balls before playing around.
Okay, well that's smart. That's smart. You shouldn't hit too many balls at the range. I'm the guy that will sit in the sand trap for 3 hours, hitting one shot till I perfect it, and that's not smart, but that's me. I love repetitive activities. I play music, and I totally.
The only other repetitive activity I was thinking is like when I hold my cell phone, right? It's in my left hand.
Could be.
It could be. Wraps around.
Yeah, it could be. What we would do, we'd get you in the office, Dr. Grove would look with his ultrasound and see if that A1 pulley is hypertrophied. Like you said, that's typically the place. It could be the A2 or the A3 pulley. Those are just bands of tissue that hold the tendon down that flexes the finger. And it may not be that. It may be you might have arthritis. You may have nothing. We don't know. But we have to examine, touch it, and look with the ultrasound. Static images like X-rays and MRIs and CTs don't do us really as much good as the mobile ultrasound. We can actually move it around. If there's a nodule there on the tendon, we can see it snap through the A1 pulley. And then if we decide to inject that area, we can actually see exactly where that little needle will be going. You'd probably have a 27 gauge or a 30 gauge needle we would inject with. It's like a teeny needle. And if we do inject, we'd use some cold spray so that it numbs it up. And I know doctors, and actually most doctors and hand surgeons that do these trigger finger injections typically do not use an ultrasound.
Oh, yeah, they don't aim at all. They're just blindly just stabbing at the fingers.
Yeah, and that to me makes zero sense that you're going to inject things like that you need an ultrasound to watch where the needle is going. There are parts of the body you don't need the ultrasound, where you want the fluid to just disperse all along a fascial plane. So the ultrasound doesn't really do any good, but Dr. Grove uses ultrasound on almost every procedure, including
almost everything. This is a really, really good example of you have to do a dynamic evaluation. You can't take a snapshot with an X-ray and say, oh, this is trigger finger. You have to actually see that tissue glide through its range of motion where you have in your symptom under a dynamic imaging system, right, like ultrasound.
And also, John, as far as I'm concerned, do not waste your time getting a steroid like a cortisone shot in that trigger finger. It will work impeccably and you'll think you are healed. But then in about 4 or 5 months, it typically comes back even worse because the steroid, cortisone, whatever it is you're using, actually is deleterious to the tissue. It breaks down the tissue. So you might try it once, but, I don't like that. It'd be better to hydrodissect that tendon. Dr. Grove can do that under ultrasound guidance and use the needle to pry the A1 pulley free from that tendon. And, you can use PRP as the solution that goes with it, or stem cells, and see how that goes. So again, we have to examine you. We have to look with the ultrasound, see what is actually happening. I can't give anyone a blanket way to treat anything. We have to touch. And people every day call in, email us, and you can get to us through the website, www.jointrehab.com, and email us on every page. And one of the most frequent emails I get is, do you want me to send in my x-rays or MRIs or CTs? I go, no. They don't tell me a darn thing. I like to have them so we're not missing something like a cancer, which could be found. But in terms of treatment, you need to touch the body, move it around, do the exam, and see where the pain is actually coming from. And one of the most horrific things that I commonly see is a person will come in and they'll have a greater trochanteric bursitis. And by the way, these terms that I'm spitting out and Dr. Grove is spitting out, if you don't know what they are, write them down and Google them and look them up. You can see your own anatomy, because in the upper left-hand corner of Google, there's a word images. You click on that and it'll actually show you pictures or drawings of what the anatomy is. So if we say something like meniscus tear in the knee, look it up. Learn about your body. Don't let your doctor dictate to you what you're supposed to have. If it's elective, that means you get to choose. Don't let your doctor choose for you. We always tell people, they say, what should we do? They go, we're going to educate you, and then you decide. We're not going to tell anybody what to do. We'll educate you, and we spend a ton of time with people educating them. And as you may have heard before, we give every patient our cell phone, and we talk to people all day long. We get text all day and all night, and we love it. We love keeping in touch with people. We find that when people trust us and know we're on their side, they heal better. Because we get a lot of people who have been to other doctors getting stem cells and platelets that failed, and then they'll heal with us. And I think a lot of it is because we spend the time loving our patients. And this is a great story. And Dr. Grove, I think you've heard it before. When I was at my medical school, the first summer after first year, we had to pick a doctor and spend the entire summer with him. So I picked an intensivist because I thought I would learn the most. He's a guy that works in the intensive care unit with patients that are dying. So I picked him, and then the first day in his office, we spent time in the office in the hospital with him. He had a woman and a man come in, and the woman had headaches, and so he had done a CT scan of her brain. And she comes in, they sit down, I sit down, he sits down, and he shows them the CT scan, and he says, I am so sorry. He said, we see a brain cancer here. And the woman started crying, and then the husband started crying, and then Mr. Softy, Dr. Darrow, started crying, and then the doctor started crying. And we all got up and we did like a kumbaya. We all were hugging each other. And, I mean, it sounds ridiculous, right? But these things happen in medicine. And we finished up with that patient, and then we went through a day of patients. And at the end of the day, the doctor sat me down in his office, just him and I, and he said, Mark, what did you learn today? And I said, I learned that you have to love your patients. And he said, you're done with me. I can't teach you anything else. You got it. And I think Dr. Grove and I feel the same way, that it's, not to be trite. Everybody uses the word love. But if a doctor is not loving his patient and he's just a technician or a scientist, he's not really helping them very much. And I know there's great surgeons that don't have a good bedside manner, but imagine how much greater they would be if they did. Mm-hmm. It's that touch that heals. And I'm not talking about magic. I'm just talking about reality.
Right. So, I was a patient of yours, Dr. Darrow, and you'd helped me a lot with a shoulder. I actually, it was bad for like 10 years. I eventually, got tired of putting up with it and went to a surgeon, and they took an MRI, and the guy said I had a rotator cuff injury, and scheduled me for surgery, but then he passed away before the surgery was to take place. And so I heard you on the radio, came in, you gave me injections in my shoulder, and after the second time, it got like 95% better, and over time, it's pretty much 100% better. It was
God, I love that.
That was
Thank you so
fantastic.
much.
Terrific result.
Thank you so much for sharing that.
The only
Well,
reason I hesitated with
yeah.
my finger is that snap part of it, because it seems like there's something, like you were talking about, a tendon that's in the wrong place, and then it
Well, it's not. It's not in the wrong place.
Uh-huh.
We described that it's most likely overuse from golf. Bad grip, maybe a good grip, but just doesn't work for you with the finger. Yeah. And again, I think we're the place to come to first. Yeah. Because I know what you'll get if you go to a hand surgeon or another doctor. You're going to get a steroid shot. They're not going to use ultrasound guidance, and that steroid is not going to help the tissue. It's going to hurt the tissue.
So they wouldn't operate right away. They wouldn't think of it as a mechanical thing that needs to be rearranged. Or
Well, there are doctors that would operate.
Yeah,
right
I was going to
away.
say, it depends on who you go to.
Yeah, the typical for a nice guy surgeon is they're going to try a steroid shot first, and then usually within a week, you're going to go, Doc, it's amazing. I feel perfect. And then you're going to come back in about, who knows? It could be a week after that. It could be a month. It could be 3 months, 4 months with a worse trigger finger, because the steroid shot, the cortisone, whatever they use, is going to deteriorate that tissue and make it worse. And you're going to feel so good, you're going to overuse it. So I think the smartest
thing... The only
thing...
thing else I can maybe tell you about my situation, I've noticed that the pain has started to move down along my finger into part of my, where things are in the hand.
Well, that can happen because if that finger locks up, the tendon's going to start straining in other parts of the hand or finger.
Yeah, you
so
totally change your biomechanics of how you move once you have that initial kind of choke point of that. Again, just like any other injury, right? You have to look at the whole picture of the body as a functional unit instead of just like individual parts, right? If one thing's kind of off a little bit, you're probably going to move a little different, especially if you're, an athlete or something, or like a golf swing. It's a lot of force you're putting through something that if you're changing how you move now, that pain can kind of radiate and go to new places.
I mean, I have no question in my mind. The least you should do is come in for a consult, have Dr. Grove look with an ultrasound, give you the real information. You're not going to get information on that really from an X-ray or an MRI.
You literally won't. Nope, won't happen.
Okay, well, listen, I'm going to do it. I'm happy to do it, and like I said, you guys have addressed what I was thinking might be a reason not to, and I'll see you guys soon.
All right. God bless you, man. It's so great to hear from you.
Thank you so much for the call.
Thanks, John. And we're looking for other callers.
We've got about 10 minutes left or so. Yep, you guys can give us a call live here. Our number 866-870-5752. One more time, 866-870-5752. You can talk with us live here, Dr. Thomas Grove, Dr. Marc Darrow. If you guys want to get a copy of our book, again, give us a call, 866-870-5752.
That's a free book. We send it out free. We pay the postage.
Pay the postage, baby. Yep, direct to you. Really amazing.
The postage is getting expensive.
It is.
It's like $8-9 every time we send one out.
I'm telling you, man.
And we're sending them all over the world. I've had, actually, Dr. Grove, I don't know if you know this. I've had patients come in, and I'd say, who referred you? And they said, someone gave me one of your books, because I've written several books, 10, 15 years ago.
Yeah.
And I said, why'd you wait so long?
Yeah.
And they said, well, I didn't believe it. And then finally I had a surgery that failed, and then I decided to try this. We do heal lots of people. I shouldn't say we heal. The treatments heal tons of people that have had surgery too. Mm-hmm. I mean, it's more difficult because the tissue is scarred. It can be missing. It's harder. You may have to do more treatments if you have surgery. But we get tons of people that have had surgery. Even things like knee replacements, we can't fix the metal, but often it's the surrounding soft tissue after a surgery that is injured from the surgery, and we can often help that. So it's fun. Yeah. I have a ball.
Yeah, I really do think this is the best job we could have possibly
it's
found. Honestly,
it really is. I mean, it is the greatest thing I've ever done. I've done a lot of things. I was an attorney before. I had a master's of tax. I've done all kinds of law. I love law, but I got to tell you, medicine is where it's at, making people happy. In law, you don't really get to make people happy as much. Because if you win, somebody else loses.
Yeah, that's true. That's true.
So you never feel good one way or another.
No, and even more so, just the culture that's at the clinic. Every single day, I get a patient commenting, "Hey, make sure you're telling so and so you guys you're awesome. The staff's amazing. The front desk, our medical assistants. It's an awesome environment to come in and get healed up. Again, even if you decide not to get treatment, it's just a really awesome place to catch a little bit of the healing vibe that we have over there."
You know what I always tell people if they go, "Well, I don't really believe it," I say, "Come in for a consult."
Yeah, it's not going to hurt anything. Again,
it's not going to hurt anything. Let Dr. Grove
doesn't hurt.
Yeah, let Dr. Grove look with an ultrasound, show you the tissue in dynamic motion. Mm-hmm. Let him show you where things are. A lot of times we'll look at an MRI, we won't see anything at all. And under ultrasound, while we're moving the joint, we can see these big tears open up.
Yep.
And then vice versa. Ultrasound is amazing because it's real. You see what actually is going on. MRI can be fake. In other words, it's overly sensitive. And I tell everyone to get one because we want to do the medical legal things right. We don't want to miss anything. And there's been at least 2 cancers I can think of that we picked up by getting MRIs, saved people's lives. They didn't come in for cancer. They came in for musculoskeletal problem. And just as an ancillary thing, we saw, once there was lymphoma, once there was a breast cancer, and they were on the outside of what we were looking for, but they were there. So I always tell people, they say, "You don't like MRIs?" I go, "I like them. I just don't use them to diagnose or treat." They're helpful because they give you a broad view of what's going on. But the ultrasound is really where it's at. It's being put as the core training in all the medical programs now. It's not easy to learn. I have probably done 20 different courses on ultrasound over the years. It's how I do my continuing education, and I can never learn enough about it. And I know, Dr. Grove, you practice ultrasound at home every night, don't you?
All the time. Yeah. Again, last couple of years, probably $200,000 I've invested just in cadaver training courses. Again, when you're going to people who do this sort of field, you got to go people that have the proper training and know what they're looking at. You have to know what normal looks like before you know what something that's not normal would look like. And
and I want to reiterate something that I've seen, and you've seen this also. I had a patient come in who had had gone out of the country. I won't say where or what clinic. Mm-hmm. And they had a knee injection. It cost them $30,000. Now it's up to $33,000, I think you said, Dr. Grove.
Yeah.
They had a non-doctor, I think it was a nurse, I don't even know what that means, out of the country, inject a knee without any guidance. The person did not get any better. They put stem cells in. I don't know what source they were, and I don't know how dangerous it was. And they also had IV stem cells. Good luck with that.
Yeah.
Anyway, we're going to the end of the show here. God bless you all. Thank you, Dr. Grove. You're amazing. I love you. And if you want to get to us at the office, the phone number there is 800-300-9300. You'll get a free copy of our book, Stem Cell and Platelet Therapy, Regenerate, Don't Operate, and website www.jointrehab.com. You can email us from every page there. God bless you all. We love you so much.
You've been listening to Living Pain-Free with Dr. Marc Darrow and Dr. Thomas Grove. Now that you've heard Dr. Darrow and Dr. Grove, call their office at 800-300-9300 and speak to one of their staff for free. And ask for a copy of Dr. Darrow's book, Stem Cell and Platelet Therapy. Regenerate, don't operate. Schedule an appointment by calling 800-300-9300. That's 800-300-9300. Or go online to jointrehab.com. Again, the website is jointrehab.com. Living Pain-Free with Dr. Marc Darrow and Dr. Thomas Grove is heard Saturdays at 10 a.m., 1 p.m., and 5 p.m. here on AM 870, The Answer. Take the first step toward a pain-free life. Call to schedule an appointment at 800-300-9300. That's 800-300-9300. Live long and pain-free. and thanks for joining us today.